Hello, my name is Tom Zindrick, and I'm CEO of Genelux Corporation, and I'm very excited to be speaking with you today. The topic is recent advances in ovarian cancer, and we'll pay particular attention to our on-prime phase 3 registrational study, which is designed to include patients who might not otherwise be eligible for conventional treatments or even other clinical studies. I'm very pleased to introduce Jane LeBlanc, a member of the Genelux team. Jane has worked with us for many years, first as a member of the clinical staff at one of our leading institutions running our phase 2 clinical study. And then more recently, we were very fortunate to have Jane join our team and help us advance our program. Welcome, Jane.
Hi, Tom. Thank you so much for having me. I'm so happy to be here.
And we're very happy that you were able to join. Would you please give a little bit of your background, just generally, as an oncology research nurse?
Sure. I basically started my nursing career actually in oncology nursing in the inpatient setting, the hospital floor. And I spent a few years there where actually at the time, chemotherapy treatment was still being delivered in the inpatient setting. And as time progressed, I was lucky enough to join the oncology clinical research department of the hospital that I was working with. And I actually spent 20 plus years there assessing different clinical trials, the patients and their eligibility, carrying them through that treatment with the physicians and following them through that care and also the overall survival.
That's really impressive background, and you bring a very unique and personal insight into what we're trying to do from a clinical development perspective, and that insight really helps drive us in a new and sophisticated way, always keeping the patients in mind. In your experience, when a patient is first diagnosed and thinking about the path that she will have to proceed through potentially various lines of treatment, could you walk us through what a typical treatment program would look like over time?
Well, sure. Specifically for ovarian cancer patients, unfortunately, a lot of the patients aren't diagnosed until later stages because the symptoms don't present themselves until that time. This is a very aggressive type of tumor. And initially, the upfront treatment for the ovarian cancer is surgery followed by chemotherapy. And the frontline treatment at the time was a taxane and platinum therapy, which patients, if they responded, may have had a few months until progression and then went on to a second, possibly, or even third or fourth line of treatment. But unfortunately, these tumors are usually very aggressive and hard to treat. And it's only been until recently, probably in the last decade, where we've seen more treatments becoming developed that are targeting specific genes or specific biomarkers in patients. But those are all still under development.
Thank you. Yeah, it was really with that landscape that I had first had the opportunity to meet with the lead investigator in gynecologic oncology at your institution. And I was sharing with him the particular characteristics of our lead asset, Olivec, which is an oncolytic vaccinia virus. And what was unique and really caught his attention, given the particular challenges of treating ovarian cancer patients, particularly those that have failed earlier lines of treatment, where the tumor is resistant and hostile to further treatment, was that the virus is not only able to directly kill tumor cells because it's been genetically engineered to selectively replicate in the tumors, but it's also positioned to stimulate the immune system in a very powerful way and remodel a tumor microenvironment that may otherwise be resistant to treatment by conventional therapies. And that investigator, Dr. Robert Holloway, approached me about our potentially doing a clinical study. And we were very excited to consider and then ultimately initiate our trial at your institution. Could you talk a little bit about what your expectations were in working with a novel agent as we initiated the trial, which at first was doing a dose escalation safety run-up to ensure that the doses that we ultimately were going to advance into later stage trials were safe for patients?
Exactly. As you mentioned, this was a phase 1 study, which for us at the institution was actually the first phase 1 study that the oncology department there had opened. So it was exciting times for us. And, with this treatment being given as a monotherapy, we weren't exactly sure what was going to be seen. Obviously, as you mentioned, we were testing the overall safety of it and what dose could be given to cause the most effect with the least side effects. It was super interesting to follow that and see those results in terms of the progression-free survival. And Dr. Holloway actually, at a certain time, felt that it exceeded expectations, and he decided to re-challenge patients with the frontline platinum-based therapy. And he found that patients appeared to be resensitized to the platinum, which was an exciting thing for this patient population that had ultimately failed the platinum at one time.
No, thank you. And that was exactly what, even though, we are well advanced in the development of the Olvi-Vec, following the science is, and really uncovering the best way to develop an asset is what really is exciting. And it takes a collaboration, not only from our labs, but also speaking with the collaborators themselves, because in fact, preclinically, we were able to show that the virus was able to resensitize tumor cells that had previously become resistant to other agents, in particular platinum-based therapies, which is the frontline therapy, as you mentioned, in ovarian cancer. For us, what was particularly notable was that these patients were so heavily pretreated that their options were so limited that they were losing hope to hear from the clinical staff, and to be able to give them the opportunity to potentially be able to be retreated with an agent such as platinum, which when it works, particularly in frontline, clinicians know how effective it can be. They know how to administer it so as to minimize toxicities. And it's often referred to in the gynecologic oncology community as the Holy Grail. And so as we moved forward, we amended the protocol, from that monotherapy to then, after treating patients with the virus, we would initiate all patients on the platinum-based therapy. And maybe you could talk a little bit about the benefits that you observed clinically for patients who were subsequently re-challenged, and maybe a little bit about their quality of life, because that's always a concern, right, when patients are put on chemotherapy.
Absolutely. As you mentioned, these ovarian cancer patients have very limited treatment options. There's only a few chemotherapies that are FDA approved for their treatment. So this opportunity of the Olvi-Vec actually causing this resensitization and bringing this platinum-based therapy kind of like back to life and giving, in the sense that it's killing the disease better and providing a better response, and patients are therefore coming into a phase of their life where their quality of life can get back to quote unquote normal, from what they've been going through with their chemotherapy. For instance, Dr. Holloway likes to reference a patient that came from out of state to the site to possibly enroll on the clinical trial. And, she was very hesitant because she still wanted to go out and do some of those things that she enjoyed doing. She was an avid motorcycle rider and had lots of plans, especially to travel the country. And so, he thought that was a good idea, but at the same time knew that it was very important that she got her treatment sooner than later. And, it worked out for her that she decided to go on to the clinical trial, that she had a good response. And she not only, went on that cross-country motorcycle trip, but she also was able to do several other trips besides that. And, her quality of life she was able to extend that and feel better and know that, there was more to be done for her.
That's so inspiring. And, it was really, patients like that, when we looked at the total data from that phase 2 study where we were combining Olvi-Vec, our virus, with platinum, that gave us a lot of excitement and encouragement to continue to progress the study or the agent in later stage clinical studies. In fact, now we're in a phase 3 registrational trial. And, I'll preface what we've been talking about with respect to the fact that what you've been saying so far is about data that was generated in our previous clinical studies. We're blinded to the data in the current ongoing phase 3 study, and so don't have any insight into that in particular. But we would like to share a little bit about the design and why we think it's such an important study. First of all, we're conducting the phase 3 in a multi-center study or trial across the country in the United States. Mm-hmm. And the purpose of that is to see if we can confirm the results that we saw in the phase 2 in a larger patient population, to really demonstrate that we have the ability to take patients whose tumors are no longer responsive to not only platinum, but often many of these other therapies, and see if we can rejuvenate the tumor to be receptive to further therapy. We're particularly excited about this trial because, as I mentioned earlier, we believe we're treating a patient population that in many respects would have little hope. We are treating patients who don't need a certain type of tumor biomarker to be eligible for the type of newer targeted therapies that you were talking about. We're treating the most difficult to treat ovarian cancer patients, the so-called refractory patients. Mm-hmm. Prognosis is very poor. And in fact, many clinical trials specifically exclude refractory patients. We welcome them. And then finally, we have an eligibility criteria where we do not limit the number of prior lines of therapy that a woman might have previously received, which is quite common in the ovarian cancer clinical trial landscape. So we're taking on an all-comers approach, and we think that positions us to have a significant impact on a high unmet medical need. Obviously, we need to confirm that those phase 2 results in the phase 3, and perhaps, Jane, you could talk a little bit about, at a high level, the clinical trial design.
Sure. Thank you, Tom. As you mentioned, this is like an all-comers type of eligibility. It's open to a lot more patients because the lines of therapy are not restricted. And the platinum refractory patients that usually are not part of clinical trials because they have such poor prognoses are actual potential patients for this study. So, the enrollment is for histologically confirmed non-resectable platinum-resistant or refractory ovarian cancer patients. And we're looking to determine progression-free survival, the safety, and overall survival of patients. This is a randomized study. So you're either on the experimental arm where patients would receive the Olvi-Vec treatment, and that's given over a 2-day period. And then we follow that at approximately 4 weeks after with the platinum-based chemotherapy and bevacizumab. Whereas the control arm patients would be going on standard of care chemotherapy and bevacizumab right away. Dr. Holloway is the principal investigator of this study, and he is at Advent Health Cancer Institute in Orlando, Florida. The overall expected timeline for treatment, patients would go through their chemotherapy, which would be approximately 6 cycles, and then on to maintenance therapy, potentially continuing bevacizumab. And the treatment, the study itself would be approximately 3 years, where we would be collecting data on the patients.
Great. Thank you, Jane. And we really appreciate your insightful comments today and the benefit of your experience and expertise. As viewers can tell, we're extraordinarily excited about this clinical trial, about giving hope to patients, but more importantly, converting that hope into reality. And in that regard, we would welcome your feedback, and we would certainly welcome you sharing this information with individuals that might be interested in joining our clinical study. For more information, please check clinicaltrials.gov and type in on Prime, and you'll find more information about our study. Additionally, we invite you to stay connected with us as we look to have future webinars, not only giving updates on our progress in this trial, but also in sharing other clinical development updates as we look to expand the observations we've seen in ovarian cancer into other multiple tumor types. Thank you. Goodbye.